haven't worn a ponytail like this in so long. Hi everybody, welcome back to my channel. My name is Magdalen Snow, as you could probably tell from the channel name. But anyways, today guys, I'm finally filming a video that I've been meaning to film. And this is really for all of my psychology major followers out there, particularly if you were in the nursing program at your school and you're switching to psychology. So if you're new to this channel, I'm a psychology student who switched from nursing. I was nursing for 2 years and then I switched over to psych because I had an aha moment. I will make a future video explaining that. Today I am deciding to sell a lot of my textbooks, my nursing textbooks, so that I can have more money to pay for future psych textbooks. But, you know, going through all of my books and all of the work that I did for nursing, I decided I wanted to share with you guys which textbooks I'm actually keeping. Because, newsflash, there is so much overlap with psychology and nursing, so much. So I'm going to be sharing with you guys which textbooks from nursing I am keeping for the sake of my psychology degree and for future reference in the psychology world. If you ever have questions about my experience as a student going from nursing to psychology, anything related to any of that information, always comment down below. I will respond to whatever questions you might have. I've never found a lot of videos talking about people that switched from nursing to psych. Usually it's the other way around. So I'm hoping that through my videos I can help some of you out there. Just an FYI, I don't only make videos about textbook things. Things do get more exciting than this, I promise, but I think this maybe could help some of you out there who maybe want to make the switch but don't realize just how similar both of these degrees are. So the first textbook that I'm definitely keeping from nursing is the Nurse's Pocket Guide, this little book here. This book is a book of diagnoses, prioritized interventions, and rationales. We used this book so much when I was a nursing major. There was a lot of work we had to do with defining a person's findings in a clinical scenario and then coming up with a proper diagnosis and proper interventions, and that's what this book talks about. Now the wonderful thing about this, and the reason I'm keeping it, is because you don't have to be a nurse to use this. This is helpful in all walks of life. As a psychology major and going into my future career, I'll be dealing a lot more with mental health as opposed to physical health, but again, like we know, it's all interconnected. So having this book and seeing a lot of the diagnoses, which a lot of them do relate. For example, one of the diagnoses is chronic low self-esteem or risk for low self-esteem. It also talks about depression, anxiety, risk for low social stimulation. All these different things are found in this book, and it offers interventions, risk factors for different scenarios, what the caregiver should do, actions by the patient, assessment, planning, etc. So you guys, if you are in a nursing program, you're probably going to receive a book like this if you haven't already for one of your classes. And if you're a psych major, this just goes to show just how overlapping those two majors can be. The next textbook I'm keeping from nursing is the Davis's Drug Guide for Nurses. This book actually, interestingly enough, was part of the reason why I realized I didn't want to be a nurse, which is so funny. This entire book is about different medications and what they do, how to administer them. Every single drug you could possibly imagine is found in this book. Part of the reason why I realized I wasn't supposed to be a nurse was because when we were doing medication administration and we were dealing with more of the numbers side of things and injections and pills and things like that, I just realized it wasn't for me. I realized I wanted to be able to sit with the patients. The whole medication side of nursing just wasn't appealing to me at all. So it's interesting why I actually decided to keep this, and it's really because, honestly guys, I have referenced this so much just in my daily life. Like when my parents are asking about a medication that they were just prescribed, I go, oh my gosh, wait, let me look it up for you. And then I go, okay, so you want to avoid this, do this, take it this way, it'll take this long to take effect, you know? So this book is actually really handy just for my own life when I need to look up a medication I might be taking or somebody else. This book also includes medications that a lot of people will be taking for their mental health. Prozac for depression, you know, any type of anxiety medication. In my future, going into psychology, I'm going to need to know a lot of these medications in terms of how they affect mental health. Schizophrenia even, you know, all these different medications will be relevant for me, so that's why I'm keeping this book. The last textbook I am keeping from nursing is Essentials of Psychiatric Mental Health Nursing. This class, my mental health nursing class, was, from a nursing point of view, when I realized that I was supposed to be in the mental health field. When I was taking this class, I was absolutely enthralled by it, and I didn't want to study anything else. I really just loved learning about psychiatric mental health, and that was my thing. And so actually this book is kind of sentimental for me because I actually read this like a leisure book because I was so intrigued by it, and I just learned so much from it, and it's so relevant for psychology. It talks about depressive disorders, bipolar disorders. It's all psychology. It's literally everything I did in my abnormal psych class, basically in a nursing textbook. But what's great about keeping this is that now I can reference more of the clinical information related to psychiatric disorders as opposed to in the majority of my psychology classes. Because I'm not in a master's or a PhD program yet, we're really just learning more of the surface information about these disorders. So having this to reference is truly going to be so important and so helpful going into the future, and even just to reference now, because sometimes I am just randomly interested in, you know, learning about like schizophrenia or psychosis or neurocognitive disorders, psychopharmacology. It's all so relevant. So guys, I don't know if this video is actually gonna be helpful to anyone or not, but really the purpose of this video is to just show you guys how amazingly multidisciplinary these careers are. Nursing overlaps with psychology crazily, and psychology overlaps with nursing. It's amazing. I'm not saying that, you know, you should have training in both nursing and psychology to be an effective psychologist or nurse, but what I am saying is that if you do have resources on the other side, you know, use them. Because really what's most important is that if you are hoping to become a clinician in the future, having as much information and as much knowledge as you possibly can to help a person is really what is most valuable and most important. At the end of the day, guys, I'm keeping these textbooks from nursing so that I can truly become as well-versed as possible and as helpful as possible in psychology for people down the road that I may be assisting. And of course for my own knowledge, because it's fun to know things. Thank you so much for watching. Make sure to give this video a thumbs up. If you are a psychology major or a nursing major, feel free to reach out to me with questions you might have. Thank y'all for watching. I will see you in my next video. Bye guys.